If you've ever Googled chiropractor near me and felt completely overwhelmed by all of the options, you got general chiropractic, sports chiropractic, pediatric chiropractic, upper cervical chiropractic, NUCA, Blair, Atlas orthogonal. I want to help you cut through that noise right now. Because here's the truth, not all chiropractic is the same. And for specific conditions we treat here at Koru, things like migraines, vertigo, chronic neck pain, fatigue, brain fog, the difference between upper cervical chiropractic care and general chiropractic care isn't just a matter of technique. It can be the difference really between finally getting better or just merely managing the symptoms. My name is Dr. Norris. I practice upper cervical chiropractic care, specifically NUCA chiropractic care here at Koru Chiropractic in Louisville, Colorado. And I'm going to give you the most honest, straightforward comparison of upper cervical versus general chiropractic care that you will find anywhere online. No sales pitch, just the clinical reality. Let's get started with what most people think when they hear the word chiropractor. General chiropractic, sometimes called diversified chiropractic, is the most widely practiced form of the profession. So typically involves a high velocity, low amplitude adjustment across multiple areas of the spine. A lot of, pushing, twisting, cracking, popping. You pretty much lie down on the table and the chiropractor kind of does a quick feel something stuck and thrusts on that. You'll hear a pop and that's just the joint mobilizing. It's not bad. It's just not actually even bones cracking. It's just nitrogen bubbles popping. It's a physiological response to the joint moving really quickly. And so general chiropractic care is really good at helping with like low back pain, muscle tension, temporary like kind of joint restriction. So it can get you moving pretty quick and back to feeling pretty good in a short amount of time. But what we don't want to do is dismiss general chiropractic. It has a real legitimate role in chiropractic, right? Like if someone calls me and they're like, yeah, I was moving over the weekend, I tweaked my back. I'm really not your guy as an upper cervical chiropractor. Typically as an upper cervical chiropractor, we're looking at very different conversations with our patients with much more complicated timelines, chronic issues that have been going on. They've often seen many people, many different providers. And in some cases, we're like the last stop before they just give up. But let's talk a little bit about what upper cervical chiropractic really is, right? So there's specific family of techniques. We all have the same philosophy. It's that if you correct the alignment at the top of the spine here between your occiput, your atlas, and your C2, your axis bone, which is really, CO, C1, C2. There's many ways to do this. I use NUCA. There's also Blair, knee chest, atlas orthogonal, orthospinology. The philosophy is all really similar. So it's all about realigning that top part of the spine, getting your head on straight, and allowing the spine to, unwind or unwrap those compensations from the top down. Okay. So we know that, the upper cervical misalignment has a really profound effect on neurological function and brain function. So when we realign these areas, we expect to see results in not just the head and neck, but really throughout the body. So upper cervical practitioners complete a postdoctoral training and certification beyond standard chiropractic school. And it's typically, you don't go to a weekend seminar and say, I'm going to do upper cervical tomorrow. It's a thorough approach, where with the analysis, the imaging, the geometry measurements we use. So here at Koru, we use NUCA and combine this technique with CBCT or 3D imaging to really get an understanding of how that atlas misalignment is affecting your body and how to best correct it. And whether that's going to resolve all your symptoms or not, we don't always know. But what we do know is if you have a big misalignment and we get it corrected, there's a better chance that your body works the way it's supposed to, and that you just feel a lot better. So I want to give you 5 reasons and ways that, upper cervical chiropractic care is just fundamentally different from general chiropractic. General chiropractic has its place, but upper cervical has its place as well. There's definitely a time and place for both. So number 1 is where we focus, right? I've kind of already alluded to this. General chiropractic care, they may adjust the top of the spine, but they're really focusing more on lumbar, thoracic, cervical, and often doing it all in the same visit. And the adjustments are made wherever there's restriction and tenderness. Whereas upper cervical care focuses on one specific region, the top of the neck, and we're not adjusting, your lower back or your thoracic spine just because you have pain there. okay? We're looking at getting the best improvement in the alignment of the upper neck and letting your body unwind and reorganize itself from there, okay? Now, I'll be honest, I do practice the Pierce Result system. So it's a specific and gentle approach to adjusting the full spine. So if I find I got someone's upper neck corrected, but they still have unresolved issues with, like, say, their low back or their pelvis, or maybe they've got like an elbow problem, I'm not opposed to doing some full spine adjusting or extremity adjusting. I just always make the upper neck the priority when someone comes in and that's the problem, because I know we're honestly going to get our best bang for our buck. We'll get the biggest, longest lasting changes if we get the upper neck set in place right, whereas a lot of the other areas, if we just focus on those, they'll feel a little bit better, but it's always going to be temporary. Right, number 2, the role of imaging. Most general chiropractors, honestly, they usually don't even do imaging. And if they do, it's really just to rule out any contraindications, making sure you don't have a fracture, you don't have a pathology like an infection or cancer, but it's really not to tell them how to do the adjustments. However, in upper cervical care, we use the imaging as really the foundation of the correction. I can't adjust someone up with an upper cervical specific adjustment without analyzing the top of their spine in a biomechanical fashion, okay? So we use the 3D imaging in our office with cone beam CT to measure how is that top of your spine shifted and misaligned, and what's gonna be the ideal vector or like geometric angle to essentially adjust that and get the biggest improvement in the cranial-cervical junction, and ultimately like unwind and, again, sort of uncompensate the rest of your spine. So we really pride ourselves on we measure, we don't guess, okay? All right, number 3, the force used, okay? So general chiropractic uses what's called a high velocity force. It's a quick directional thrust, designed to move the joint rapidly past its passive range of motion and restore motion and reduce restriction. With NUCA, it's a very different adjustment. We don't use a high velocity force at all. It's really like a sustained contact with my hand, so it's a hand adjustment, but some pressure coming from the right angle on the transverse process here of your atlas bone, right? Whether it's the left side or the right side. The force is honestly so gentle that most first-time NUCA patients get up and go like, that was it? But yes, that was it. And the precision that allows us to get this correction, the gentle force, really gets us the best result. So like the nice thing about it too is that for our really sensitive patients, maybe even patients who have diagnosed instability, whether it's Ehlers-Danlos syndrome or like just CCI from a car accident or injury of some sort, these patients, we're not using too much force, right? We only use enough force to get things moving, and it's a slow buildup of that force or that pressure. And so it's like perfect for your body essentially, right? We never just put a big thrust in and go, oop, that was a little bit too much that time. It's always just a slow buildup of the pressure from the right angle that just helps everything move back into the right place. All right, number 4, the treatment goal. Okay, so most general chiropractic care operates really on a maintenance model, right? It's all about symptoms. They're gonna adjust you a couple times a week and then they'll get down to once a week. But the problem is, because it's like non-specific and it's just really focused on temporary improvements in range of motion and symptom relief, when the problem keeps coming back, you need to keep coming back. So a lot of it is based around going down from 4 or 3 times a week down to like maybe once a week with maintenance care. NUCA is very different. So what we're really basing our success on is hopefully that you actually feel better, but ultimately like how well are you holding and how much of a reduction of the misalignment did we get. So ultimately there's no guesswork in this because we do before and after imaging, so we know if we're doing a good job or not. And then the last part is, can you actually hold your adjustments for longer and longer periods of time? So maybe in the beginning it only does last a few days, but eventually it's a couple weeks, and then it's a couple months, and then it's several months, and for some people it even ends up being a couple of years, which is pretty amazing in my mind. Don't know any other type of chiropractic care where the results last that long. And typically, you're living in real life, you're not living in a vacuum or a bubble, so you're going to need to come in and get checked and corrected occasionally. And for some people it is more often. Maybe you have ligament laxity or instability or really severe arthritis in your neck that's going to make it so you only hold those corrections for a limited period of time, maybe several weeks. But ideally it's several months, and we try to get our patients down to the least amount of care that's going to allow them to still see the results and keep their bodies in the right positions without kind of going all the way back to the start. Okay, so less is more ultimately. All right, number 5, the conditions we focus on. As I mentioned, general chiropractic care is really good at the evidence shows it's really good at like low back pain, neck pain, maybe some shoulder tension, or even simple headaches. But upper cervical chiropractic has documented outcomes across a much broader range of neurological and systemic conditions, right? So not just things like vertigo and migraines, but also Meniere's, post-concussive syndrome, POTS, dysautonomia, high blood pressure, brain fog, chronic fatigue, and more. So like, because of the atlas's proximity to the brainstem and the blood flow in and out of the brain, as well as the cerebral spinal fluid flow, the correct alignment there is super important for overall neurological and physiological function. And so simply put, if you got a little crick in your neck or achy low back after gardening or moving all weekend, probably going to a traditional chiropractor or general chiropractor is going to work great, right? But if you've got a chronic symptom that you've seen multiple specialists for, things that your body's just not responding to, maybe you've tried multiple medications, or even you're trying to get off medications, and you've just been dealing with this problem for months or maybe even years, that's a good time, if you haven't had your upper cervical spine evaluated, to give it a serious look. Patients who tend to do the best with upper cervical care are usually people who have been through everything. Honestly, they've gone through the medical model, they've tried various treatments, they've gotten maybe partial or temporary results, but they've really never had their atlas alignment specifically evaluated. And when we get those great corrections, they see amazing results. So lastly, I want to address insurance, because a lot of people are frustrated. They hear we're the best, they hear that we can help with all the problems that they have, but why don't you take my insurance? Well, it's not my fault, man. I swear. It's really the insurance company. The way they work, they want you to treat right where the symptom is. And I see this problem in physical therapy as well. Someone goes in, they've got sciatica, but they've also got some like chronic neck pain, and the physical therapist is like, hey, we're billing your insurance. Your active complaint sciatica, that means I can only work on your low back and your glutes and your sciatic nerve, right? Well, the same thing's true with upper cervical. If you've got sciatica and I adjust your upper neck, and even if it gets totally better, the insurance company is going to look at it and they're going to say, well, you had pain in your butt and your down back of your leg, but he adjusted your upper neck. We don't see the connection. And then they'll just deny the claim, right? So it makes it a lot more simple and convenient and affordable, not just for myself, but for the patient, because I don't have to deal with fighting insurance companies all the time, right? I'm paid for the value of the care that I provide, and we're able to make care convenient and affordable by using things like care plans. So I know that someone's going to come in, they're going to need to come in for several visits at least. We're going to probably do at least one re-exam. So I can put that care plan together and we can spread it into payments so that you're not just paying a lot of money on the front end of things, not knowing if things are going to work well or not. Okay. All right. So I've explained a lot about the differences between traditional or general chiropractic care and upper cervical chiropractic care, and the difference in symptoms and approaches and imaging. So hopefully you just found this valuable, and if you've been wondering about upper cervical chiropractic and if it's a good fit for you, I would love to continue having this conversation. You can hit us up here at Koru Chiropractic in Louisville, Colorado. We really serve the greater Boulder and Denver area, so we see patients from Broomfield, Lafayette, and Superior, Erie, honestly up and down the Front Range. But if you want to check us out, go to koruchiropractic.com, and if you want to do a deeper dive, check out all my videos about NUCA and really a lot of the symptoms I help with, like vertigo, migraines, post-concussion syndrome. Make sure you just subscribe to the channel and you won't miss them, okay? So until the next time, I'm Dr. Norris Goldberg. Thanks for watching.